3, 2, 1.
All right, let's do this. Get set.
Headed for the open door.
This is Running Flat Radio with Chris Usinski on AM 800 CKLW, the information station.
You know what? Let's get to our first guest in studio, and in 2009, I was right next to the young man who died in the half marathon at Detroit. Mm-hmm. And that was the year that 3 people had died.
I remember that.
From sudden deaths, sudden cardiac issues. And that really changed my life as a runner when that occurred.
But you know what's interesting about that was when I got back home, I had people saying to me, why would you want to run? Why would you want to run?
Yeah.
You have 3 people died during a race. You know, that's going to happen to you. That's a silly thing that you're doing. And that's what's going to be interesting about our guest tonight. He's going to be able to kind of talk to us a bit about that.
I've been in meetings as a race director with police, with senior police officials, where we talk about a marathon or a half marathon or a 10K course. And the police official has actually said right to my face, why are we even wasting our time with this? People die in these things.
Yeah.
Let's just say no and go away.
Mm-hmm.
And it's the wrong attitude to have. Our sport is a great sport. It's a healthy sport. It's where we're also a very accepting sport. It doesn't matter whether you walk it or run it or if you're super fast or super slow, we don't care.
Yep.
It's all about getting you off the couch, getting you in the 5K, getting you more healthy and giving you a better quality of life. And to talk about that is an old friend of ours, Dr. Tarhouni from the Canadian Cardiac Center. We met a number of years ago when you were pioneering the cardiophone. And you brought the cardiophone to Run for Heroes Marathon, for the World Alzheimer's Day Run for Heroes Marathon 3 years ago. And that to me, and I mark my words because we talk to a lot of industry people, that will revolutionize our sport within this decade.
I actually had the opportunity on that race to wear one of your phones, which I thought that was kind of interesting talking to you afterwards about, having it on, what it showed you about. And how did that work? Like I had the device on me during the race. And what was coming back to you?
Absolutely. First of all, thanks, Chris and Kelly, for the opportunity to educate the people. Would like them to be more active. And it's first of all, I think exercise and running is very important, and everyone should continue to run and exercise. Go back to 2009 and this background about the cardiophone, why we get interested with cardiophone. 2009, we are there, and we see within 16 minutes, there is 26 years old, 36 years old, and 65 years old marathon who died suddenly within 16 minutes on the bridge just next door to our Windsor Cardiac Center. It was shocking for us. I know me and my team is something wrong. We should do better than this. We should preventing sudden cardiac death. So we thought to get a team from US and from University of Windsor, and we did our R&D, research and development, and we thought that we need to do a better job than this. So we went to the company in US and worked with them, and we thought that if we're able to monitor the athlete while he's running, real time, and getting the ECG signal, the cardiac signal, to central monitoring stations, we might able to stop that high-risk victim from running, and we might preventing sudden death. It took about 3 years to get things around September 2012. Actually, in the history, Chris and Kayla, as you know, this is the first time in the history we're able to get a clear signal from marathon runner real time while he or she running.
Now, on your end, what kind of things were you seeing? Were you seeing spikes in that?
Absolutely. The victim, unfortunately, before have the sudden cardiac death, there's a lot of abnormal electric signal. Will actually, the heart transmit a lot of abnormal signals before he went flat. It takes about probably an hour or half an hour before sudden death.
Really?
So if we're able to detect those early sign, early abnormal electric signal, we're able to preventing death.
Mm-hmm.
And what a cardiophone work, actually, it's a very small device, can be used for clinical practice, be proved in Canada for many years, and we use it for our patient, where the person will wear the device and connect it through the SIM card, through the antenna, through the satellite technology, and we have at Windsor Cardiac Center 24/7 monitoring stations where we're able to monitor the patient heart. So every single heartbeat count. Mm-hmm. And if we identify any abnormal beat, we're able to actually go back to the patient and we'll tell him, listen, something wrong there. And we have tremendous success. Actually, today, just 2 patients I called in from home because they have abnormal electric signal, and we started medication, otherwise you're going to have a stroke.
Now, as runners, we're very stubborn people. We run through everything. If I don't have a cardio phone on me, how do I know that I'm kind of in danger of pushing it too far?
Absolutely. If you look at what we do now, just look at the stat. Chris told me we don't have much stat, and that's right. We have some stat. If you look at the Canadian stat, for example, we have probably every 15 minutes, there's Canadian somewhere who have sudden cardiac death.
Wow.
It's a lot. 4 per hour, 40,000 per year.
Is that number going up?
Actually, unfortunately, the bad news is the CDC, which is the Central Disease Agency in U.S., is going up in three people, actually, 3 group of people. Unfortunately, young women going up 30%, sudden death.
Really?
Wow. Yeah.
That's surprising.
In young people between 18 and 30, about 10%. And the African American is going up. So the sudden cardiac death going up in young women and young athletes because they have one of the major reasons, because actually there is, as you know, Chris and Kelly, there is more number of people now running and exercise than 10 years ago.
Mm-hmm.
Okay.
And this is there. So what we need to do, if you look at the new society called SHAPE, which is American society called Society of Heart Attack, which is sudden cardiac death equivalent prevention and eradication, SHAPE. They have a guideline. And if you look at the guideline now, any person over 45 male or 55 female plus 1 risk factor, or young person with 2 risk factors should be screened for heart disease.
Now, when you're saying a risk factor, what's a risk
Those
factor?
are 5 common risk factors, which is hypertension, high blood pressure, diabetes, smoker, high cholesterol, family history of heart disease. Okay. So for the audience, if anyone has 1 or 2 of these risk factors, should go to her or his family doctor, ask for screening, how it can be screened. The other fact is very bad, actually. If you look at the most common presentation symptoms, how people present with heart problem, 50% present with sudden death. So sudden death is the most common presentation of heart disease.
And it's too late.
It's too late.
It's way too late.
It's too late. 50%. So actually, we don't see those people. That's why at Windsor Cardiac Center, you ask me, do you go a lot of the hospital? I mean, not much, because I think we need to preventing the people go to the hospital. Because if we wait for the patient to come to the emergency room, you have only 50% of them. They don't see the other half. And that's why now, even the North America, Canada, American Society of Cardiology and Canadian Society, we do a lot about prevention.
Right.
Acute treatment is important, but prevention is more important. So I think the message is very simple. If anyone has 1 or more risk factors, which is high blood pressure, high cholesterol, diabetes, family histories, smoker, should see their family doctors. And we do screening for heart disease before involve into very strenuous exercise like a marathon run or half marathon.
Now, what does screening involve?
It's very simple. And we start the screening process actually for athlete and for general public. Involve a questionnaire, simple questionnaire to ask. Then do simple cardiac test. Start with simple ECG. And if you find something abnormal, we can go to the ultrasound of the heart. Maybe you have congenital heart disease, something wrong with the muscle of the heart. And then if you have any abnormality, we can go to the stress test. And we here in Windsor, we pioneer stress echoes, which is a diagnostic test, mixture of a treadmill and echo, taking a picture of the heart while the person running on a treadmill, and it's very, very diagnostic. Okay. So it's a combination of questionnaire, simple ECGs, ultrasound of the heart, or stress echoes.
So when we come back, I want to talk about that. I want to go back to the cardiophone, and I also want to talk about how that's revolutionizing the entire industry. And so we'll be right back with Dr. Tarhouni from the Canadian Cardiac Center. You're listening to Running Flat Radio on AM 800 CKLW.